Most of us probably think we know CPR, but what if I told you the rules have, well, they've changed? The science of saving a life is always moving forward, and today we're going to dive into the latest guidelines to really understand how, and more importantly, why, those first critical moments are handled so differently now.
And this isn't some rare event. It happens way more often than you'd probably guess. Every single year, right here in the US, around 350,000 people have a cardiac arrest outside of a hospital. And that number right there is exactly why this science is so urgent and why getting it right can literally be the difference between life and death. All right, so here's what we're going to cover. First, we'll get into why chest compressions are now the absolute top priority. Then, we'll look at the vital differences between CPR for adults and for kids. We'll cover the brand new 2025 science updates, see how things are done differently in Europe, and then wrap it all up with something called the chain of survival. Okay, first things first, let's talk about the single most important idea in all of modern CPR. I want you to forget everything else you think you know for just a second, and remember this one thing. Compressions are king. The entire philosophy now is built around one goal: keep that blood moving no matter what. So this slide right here, this shows probably one of the biggest, most fundamental shifts in emergency medicine, going from ABC to CAB. So why the switch? It's actually pretty simple. All that time spent checking an airway and giving breaths first was just dead time. It was a delay. By starting with compressions right away, you get blood moving to the brain instantly. Think about it. The person on the ground only has to hold their breath for about 18 more seconds while you pump away for that first set of 30. And all of this leads to a really important idea called chest compression fraction, or CCF. The easiest way to think about it is hands-on chest time. It's just a way to measure what percentage of the entire rescue is spent actually physically pumping that heart. And here's why that matters so much. The best rescue teams in the world are aiming for a chest compression fraction of over 80%. That means if a full minute goes by, you want your hands on that person's chest, pushing for at least 48 of those seconds. Because every single time you stop, for whatever reason, the blood flow to the brain just stops. Dead. The goal is to keep those pauses incredibly short. Okay, so now that we've established that, it's super important to know that CPR isn't a one-size-fits-all kind of deal. You have to change your technique based on the crucial differences between adults and children. And this table gets to the absolute core of why they're different. See, in adults, a cardiac arrest is usually a heart problem, an electrical issue. But with kids, it's almost always a breathing problem first, maybe from choking or drowning. That's why those rescue breaths are just non-negotiable for children. They are absolutely critical because kids need that oxygen. And of course, you'll see other changes, like how deep you push and where you check for a pulse. And naturally, the way you place your hands has to change too. For an adult, you're using 2 stacked hands. For a child, it might be 1 or 2 hands, really just depending on their size. And for an infant, it's a much more delicate approach, either with 2 fingers or the technique where you wrap your hands around and use your thumbs. The whole idea is just to match your force to the person's size. All right, let's jump right to the cutting edge, shall we? The American Heart Association just dropped its 2025 guidelines, and they fine-tuned how we should respond to a bunch of different emergencies, all based on the very latest evidence. So, what's new on the block? Let's run through the big ones. For the very first time, we have a formal choking protocol. 5 back blows, then 5 thrusts. There's also new guidance on opioid overdoses. Give naloxone if you have it, but do not let it delay starting CPR. Plus, there's a huge new focus on ethics and a single, unified chain of survival for everybody. But here's what I find truly fascinating about this new update. It's what it tells us about the science itself. Okay, so look at these 2 charts. We've got 760 recommendations in total. The one on the left shows how strong the recommendations are, and the one on the right, that shows the quality of the scientific evidence behind them, with level A being the absolute best. And this quote from the report, wow, it just says it all, doesn't it? Only 1.4% of all the guidelines are based on that top-tier level A evidence. This really pulls back the curtain on why the rules are always changing. I mean, think about it. You can't exactly run a perfect double-blind clinical trial in the middle of a cardiac arrest, right? So the science is always evolving based on the best data we can get. And, that constant evolution means that not everyone lands on the exact same page at the exact same time. While the main ideas are the same pretty much everywhere, there are some really interesting differences between the US approach from the American Heart Association and what they do over in Europe.
It really comes down to two different core philosophies. Here in the US, the AHA generally prefers a more cautious, very standardized, step-by-step method. Over in Europe, the European Resuscitation Council often goes for a more aggressive, hit it hard from the start approach, trying to make a big impact with that very first move. And you can see this play out in the actual numbers in the specific treatments. For one of the main heart rhythm drugs, Europe starts with literally double the dose we use in the US. And for certain defibrillator shocks, they say go to max power right away, while the US guidelines say to start lower and work your way up. It's that classic debate, right? Do you go in with everything you've got from the very start, or do you start cautiously and ramp up? All right, let's zoom out for a second and look at the big picture. Because as important as your CPR skills are, they're really just one piece of a much larger puzzle. It's a system called the chain of survival. Everything, and I mean everything, starts right here. The very first link in the chain is someone seeing what's happening, recognizing it's a cardiac arrest, and calling for help immediately. That one simple act kicks the entire system into gear. Next up is the part we've been focused on. Somebody starting high-quality CPR right away. Pushing hard, pushing fast, and making sure that chest compression fraction is as high as possible to keep that blood moving. The third link is all about the shock. Rapid defibrillation. For some kinds of cardiac arrest, an electrical shock from an AED is the only thing that can reset the heart. Getting that machine on the person's chest and using it fast is absolutely vital. This is when the pros arrive. The fourth link is all about advanced resuscitation. It's the paramedics showing up with advanced drugs, with sophisticated equipment, and taking over the rescue effort with a higher level of care. And look, the job isn't done just because the heart is beating again. Not by a long shot. The final links in this chain are the specialized care the patient gets in the hospital after the arrest, and all the support they need for a long-term recovery. Because a chain, as you know, is only as strong as its weakest link. And every single one of these has to hold. So all of this leaves us with a really big question to chew on for the future. As some parts of the world push for these more aggressive strategies, like higher-powered defibrillator shocks from the start, what does that mean for how we train people, for the kind of equipment we build? And maybe most importantly, how do we make sure that everyone, no matter where they are in the world, gets a fair shot at survival?